All right, YouTube lovies. That really sucked. Um, I boohoo bawled through all of it. I'm still trying to compose myself, but take your therapy seriously. I'm more motivated than most people because my mental health state depends on me playing my guitar. I'm not going to go on my sad story, but we all have one. But I'm going to make this a useful video because I thought I was doing great for recovery because I'm not having major pain issues because I've been listening to the advice of the doctor by not using my shoulder, moving my wrist and elbows when I can, but I can put my sling on easily without a pain incident, so I will demonstrate. When you're bending over with your arm dangling, I don't even need to get that far. I can comfortably pick it up and slide it up my arm, get it nestled in there, and I'm keeping the floppy thing doodle, yes, these are technical terms, and my thumb support handy there, and I can just reach over and grab the shoulder support, which I have a love-hate relationship with, and then I can clip that in place. And sometimes I just have to do a little hula dance to grab the back strap. Back straps as in venison, my favorite. Really, really miss my sister and my brother-in-law in Michigan. Oh God, this is that post-surgical depression crap I mentioned earlier. But anyway, this is what I'm trying to do for therapy. I'm muscling through, making note of when and where I can proceed. Again, I started this whole thing off with anything I'm supposed to do with my left arm and how far I'm supposed to go, and it's not really happening for me right now. And I don't know if it's more anxiety or fear of hurt, but it doesn't feel good at all. But I'm going to do what I'm told, and I see the physical therapist again. I don't even know what day it is. I think Tuesday. I think on the 18th. Yeah, on the 18th. So, rotator cuff repair, surgery, recovery, solo. This is not even a tip and advice. This is to, I guess, tell anybody out there if you're about to go through it, let's be realistic. This is a trauma to your body. I know exactly what they did. They don't show that in the video that you provided, but and I agreed to it because I want it to be fixed. But you know, they're basically pounding a hole for your anchors. You know, those drywall anchors that you hang up pictures and things with, shelving units with. That's what's in your shoulder. You know, that's a severe trauma. So I guess my body is responding to a severe trauma. You know, I have underlying pending PTSD and depression, anxiety issues I get to deal with anyway, which I've done my whole life and thought I was pretty capable of doing it. At any rate, this has definitely put me in a weakened state, physically and emotionally. So if you're going through this alone, make sure you have a support system outside and ask for help. You know, my family's all up north. My sister had to fly down to be with me for the surgery a couple of days, 5 days, whatever, right immediately for the surgery. But after that, I'm on my own, and luckily I have friends that bring food to me, and I can ask for help. So the most important thing is, though, do your physical therapy. And I just showed you, it's gonna suck, but if you want to get results, you have to do it. The easiest ones for me, obviously, were the stretching routines, you know, to stretch all the muscles, because I'm locked up tight here, shoulder blades on both sides. So do your stretches. The biggest mistake I just realized, which is probably what I should have told you right from the beginning, is medicate before you do your physical therapy. I had to do it late in the day. I try to do it first thing in the morning. I did all the stretches and everything in the morning and ticked that off, but save this unfun part for now. And I should have done, well, I did a couple of stretches, but I don't even remember what I was about to say. Anyways, God bless you. Good luck.